Thank you for all being here. My name is Dan Mazier. I'm the Conservative Shadow Minister for Health. I'm joined by my colleague, Member of Parliament Todd Doherty, President of the Canadian Nurses Association, Kim LeBlanc, and former Executive Director of the Paramedic Association of Canada, Chief Pierre Poirier. We're here today to call on Parliament to fast-track a bill that protects healthcare workers from violence on the job. Over the past year, I've heard stories from across Canada that no healthcare worker should ever have to experience. Nurses punched in the face while changing dressing. Paramedics sexually assaulted in the back of ambulances. Healthcare workers told that violence is simply part of the job. And let me be absolutely clear. Violence isn't in the job description of healthcare workers. Turning a blind eye to assaults against healthcare workers is driving Canadians out of professions we can't afford to lose. Canada is short 60,000 registered nurses. Every assault pushes more people away and discourages the next generation from entering the field. The Canadian Federation of Nurses Union surveyed more than 4,700 nurses this year. 6 in 10 reported experiencing violence on the job in the last 12 months. Nearly half faced physical violence. Almost 1 in 5 reported sexual abuse. In my home province of Manitoba, assaults against nurses have nearly tripled in the last decade. Behind these numbers are human beings. A nurse who goes home wondering if they can face another shift. A student watching all of this and deciding, I'm not going into healthcare. Our healthcare workers have cared for us, and it is time politicians cared for them. That is why we are calling on the House of Commons to pass Bill S-233 and to pass it today. Bill S-233 would require courts to treat an assault on a healthcare worker or a first responder as more a serious offense at sentencing. Right now, a nurse can be assaulted at work, and the justice system often treats it no differently than a bar fight. That is wrong. Bill S-233 fixes that by ensuring attacks on the people saving lives carry real consequences. Parliament has already agreed on this. In the last Parliament, Mr. Doherty introduced an identical bill, Bill C-321. It was unanimously supported in both the House and the Senate, fully studied and ready to become law. The only reason it's not law today is because the Liberals prorogued Parliament and Mark Carney called an election. There is no excuse for delay. So today, we are calling on every member of Parliament from every party to put politics aside and fast-track this bill. Any MP who blocks or delays this bill from passing is allowing violence against frontline workers to continue without punishment. This is about showing healthcare workers that their safety matters. It's about telling Canadians that violence against people who care for us will no longer be dismissed as part of the job. Let's pass this bill, and let's do it before Christmas. Now with that, I'll turn over to my colleague, Mr. Doherty, MP Doherty, whose leadership and persistence is the whole reason why we're here today. Thank you.
Thanks, Dan. Good morning, everyone. I'm Todd Doherty. I'm the Member of Parliament for Cariboo Prince George. I am the Shadow Minister for Addictions and Mental Health. As MP Mazier said, we're here today to call on the House to fast-track S-233, a law that will finally protect those who protect us. We're talking about our frontline heroes, those who run into burning buildings, those who heal our broken bones, those who hold our hand as we take our last breath. They are our nurses, our paramedics, our firefighters, our frontline heroes, our silent sentinels, and they deserve to be safe on the job. Bill S-233 is the exact same language as my previous bill and intent as Bill C-321, which I introduced in the last Parliament. C-321 was born out of the 2019 Health Committee report violence facing our healthcare workers in Canada. It was recommendation number 3 that a bill or a change to the criminal code which would make violence against or an attack against a healthcare worker an aggravating factor at sentencing. It is supported widely by the associations that this would introduce. The International Association of Firefighters was here on the Hill just 3 weeks ago. It was their number 1 ask, and it has been for the last decade. The Police Association, or the Paramedic Association in Canada, the Paramedic Chiefs of Canada, BC Nurses Association, the Canadian Nurses Association, all calling for action, all calling for protection. I introduced Bill C-321 March 9th of 2023, and it was passed unanimously by the House of Commons at third reading almost a year later on February 28th of 2024. It has been studied once again over a year. It finished consideration at the Senate Committee on Legal and Constitutional Affairs December 10th of 2024. C-321 could have been law last Christmas, this time last year. During the bill's study, we heard harrowing testimony from first responders and frontline healthcare workers. I have to tell you that it is a weighty subject. How far we have fallen, where a nurse can be punched, knocked out, for just simply taking somebody's blood pressure or taking blood. How far we have fallen where a paramedic can be attacked, thrown downstairs, their ankles broken, sexually assaulted in the back of an ambulance. And our system allows this to take place. Our frontline heroes are being hunted and attacked, and yet there's no protection in place. Transit workers have more protection than our frontline heroes. We heard stories during the last Parliament where firefighters cannot, they can't turn down, they have to respond regardless of how dangerous the situation is. Bill C-321 could have been passed into law this time last year, and it should have been passed into law. If it weren't for prorogation and eventual dissolution of Parliament, we wouldn't be having this conversation right now. There would be protections in place for our silent sentinels. But unfortunately, 321 died on the order of paper because of Parliament's shutdown. Thankfully, our Conservative team in the Senate, led by Senator Housakas, brought the bill back in the form of S-233, worked across all party lines in the Senate to get this bill passed unanimously. It was sent over to our House in early October, which we have worked tirelessly across party lines to get this bill passed unanimously. It should be law. But unfortunately, we have a side that's putting party politics over people. This isn't a partisan issue. It shouldn't be a partisan issue. And it's time for us to finish the job. Today, I'll rise in the House of Commons and ask Parliament once again for unanimous consent to pass Bill S-233 at all stages. It should have been law last Christmas. Now we have a chance to put partisanship aside and pass it before Christmas. I hope all parties can come together today to send a message to our first responders, our healthcare workers, that we see them, we hear them, and we will always have their back. And first and foremost, send a message that violence is not a part of their job description and it will not be tolerated. Send a message that anybody wishing to do harm to those who serve us, protect us, heal our broken bones, hold our hands when we take our last breath, that they will be punished to the full extent of the law. That's what S-233, that's what C-321, that was the intent of those bills, this bill. I thank you for being here today. I thank you for listening. And for now, I'll turn it over to Kim LeBlanc, the president of the Canadian Nurses Association. I can't say anything more impactful from the story than what you're going to hear now. Stories, real life stories of what they've experienced. And for that, I say thank you to those who are here. today. Thank you.
Thank you. I want to start by thanking the Minister for bringing this forward. As a Canadian nurse, this is something that's very near and dear to my heart. He said, my name is Kim LeBlanc, and I'm proud to be the president of the Canadian Nurses Association. We are the professional association that represents over 500,000 nurses in Canada. And we strongly support Bill S-233, which would require courts to treat assaults against healthcare workers and first responders as an aggravating factor in sentencing. Far too often we hear that nurses are encouraged not to report, or as was alluded to, when sentencing does occur, it's a very minor sentence. This is a concrete and necessary step towards addressing what has become an alarming and unacceptable rise in violence directed at nurses and other healthcare workers and first responders across Canada. This legislation aligns directly with CNA's policy roadmap, which calls for stronger enforcement of federal protections to prevent harassment and violence in healthcare workplaces. Measures like those proposed in Bill S-233 send a clear message. Nurses deserve safety, dignity, and respect in every setting where we provide care. Les infirmières et infirmières méritent des environnements de travail sécuritaires. Respectons l'exemple de violence et celui appliqué à tous les contextes de soins d'un à l'autre. Violence towards persons who provide health services and first responders has increased dramatically in recent years. Across emergency departments, long-term care homes, community clinics, home care settings, and primary care. And as a lifelong career nurse who's worked across the spectrum of care, I can tell you that I've experienced violence in every one of those settings. Now nurses face disproportionately high levels of verbal threats, physical assault, harassment, and psychological harm. I challenge every Canadian to think about going to work every day and having someone swear at you because you asked them how they were, or to throw something at you because they're in pain. A January 2025 report by the Canadian Federation of Nurses Unions found that 61% of nursing staff experience a serious workplace violence problem in the last 12 months, including verbal abuse, threats, harassments, physical assault, sometimes involving weapons, drugs, and other objects being brought into facilities. These incidents are not minor. They lead to concussions, broken bones, trauma, burnout, moral injury, and long-term physical and mental health impacts. Many nurses describe going to nurse every day feeling unsafe. Passing Bill S-233 will not solve the crisis on its own, but it will act as a deterrent, and it will send an important signal to the public and to our justice system that violence against nurses and all persons who provide health services and first responders is never acceptable. Violence doesn't only harm nurses, it harms patients and it harms our communities. Unsafe environments undermine care quality, continuity, and timely access to services. When violence forces nurses to take sick leaves, retire early, or leave the profession altogether, staffing shortages worsen. That impacts wait times, health system capacity, and access to essential services across the country. Protecting nurses is not just about safety. It's essential to retaining experienced staff, supporting early career nurses, and stabilizing the health workforce at a time when the system is under immense pressure. And while we appreciate being called heroes, we want to be respected for the professionals that we are, and we want to have a safe work environment. Bill S-233 is an important and meaningful step towards creating safer work environments for the nurses who care for Canadians every day. The CNA, we would urge all parliamentarians to move this legislation forward quickly. Le projet de loi S-233 envoie un message important. Au Canada, aucune forme de violence envers le personnel d'infirmière ne peut être tolérée. Our message is simple. Nurses deserve to feel safe at work. Their safety is tied to the safety of patients and the stability of healthcare systems across the nation. Passing this bill is one of the clearest ways to demonstrate that Canada takes this crisis seriously. Thank you. Merci, Megwitch.
Thank you. And now Chief Perrier, you have a few words.
Good morning. Bonjour, c'est Pierre Poirier. Je suis le chef du service paramédic d'Ottawa. I'm Pierre Poirier. I'm the Chief of the Ottawa Paramedic Service. I'm here representing the Paramedic Chiefs of Canada and all paramedics in Canada. This is an important bill. S-233 is an important bill because, as was said much earlier and is said over and over again, violence is not part of the job. No one expects to be assaulted at work. It really is important that paramedics, that all healthcare workers feel safe, that they go home, and that they feel safe at home. That the changes in the legislation are important to recognize that it can't be tolerated as a society that those individuals who are here to help you, to provide care, that they're assaulted at work. It's not acceptable. It's never been acceptable. And this piece of legislation is important. It's a recognition of our contribution to a safe society. Just recently, the Auditor General in the City of Ottawa solicited on a survey from paramedics in Ottawa, and the numbers were staggering. And here in Ottawa is a microcosm of the rest of this country, that paramedics on a daily basis are assaulted. Healthcare workers on a daily basis are assaulted. It's not acceptable. This is an important piece of legislation, and I thank the members of Parliament. I believe it's a nonpartisan issue that should be accepted, that should pass quickly, in a recognition that healthcare workers deserve to go to work, to be safe, and not be subject to violence or assault. Thank you.
Thank you. Thank you, Chief, and thank you for all. I guess this time we'll take any questions, if there are any. Yes.
Hi, Tessie Sanchi with the Hill Times. My first question will be for Mr. Mazier and Mr. Doherty about the bill itself. So C3, a government bill in 2021, received royal assent. It seems to have done what you're asking for in terms of the aggravating circumstance. Okay, well then you can correct me. What is the difference between your bill and what the government bill did 4 years ago?
So it is complementary to C3. C3 dealt with primarily during the time of COVID, the violence, the protests that were going on around the building, around our healthcare centers. And so it dealt primarily with that. And so our bill C321 was complementary, and the minister said that at the time. That's the reason why we've got a unanimous consent on it, was complementary to it.
Okay. But C3 also spoke about violence against healthcare workers.
This takes it to a different level in terms of aggravating factor for it at sentencing, and it specifically talks about healthcare workers and first responders.
Okay, so that includes the fire chief. Sorry, I know I'm going
yeah,
beyond two,
yeah,
but just to clarify.
Yeah, you're right. Yeah,
Yeah, okay. My next question will be for the stakeholders, if they don't mind, just about, you know, kind of got the ball rolling a little bit with C3 4 years ago. I understand it's complementary, but what has the situation been in the last 4 years that you're just like, we actually need stronger, more forthright legislation on this issue?
So every year that I've been a nurse, I've seen violence increasing in the workplace. Since the pandemic, we have seen it rise exponentially. It almost appears that it's open season on healthcare professionals. And, you know, when you talk to any healthcare professional or first responders, you know, I think the chief rightly said, people are talking about daily occurrences. So it is rising astronomically.
Yeah, thank you. It's a recognition that, if I can go back to your question in terms of the aggravated assault, it's an important piece because right now the judicial system doesn't seem to have enough positive encouragement to deal with the issue. And I think by creating the context of aggravated assault, I think it'll be taken much more seriously throughout the whole judicial system. And I think that's an important recognition for healthcare workers, that the societal mechanisms are here to support us. When we talk about the individual effects, you know, when I mentioned that the Auditor General here in the City of Ottawa looked at it, it's something that's, you know, an epidemic or endemic, but none of these items are acceptable in terms of us providing care to individuals in our community. So it really is kind of an important piece, and I applaud the members of Parliament who have persevered on this issue, because I think it is time that the violence against healthcare workers stop. Thank you.
Any other questions? Sure.
Third question, if possible?
Sure.
That would be great. I believe it was MP Doherty that mentioned party politics, and, you know, you'll be rising in the House later today. Any other details you can provide about more specifically why this bill hasn't been able to get unanimous consent? I mean, I've been here long enough to see that, you know, all parties do come together when there is a common consensus on an issue.
I think that's a great question to ask the House Leader of the, Steve McKinnon of the Liberals. We have worked across party lines on the front bench on this, all across the way, through the last iteration of it in C-321, up to 2 weeks ago, or the last time that I asked for UC on this. The conversation that Steve McKinnon and I had on this was essentially that the healthcare workers are going to have to wait just a little bit longer.
Wow.
And that's shameful. And that's exactly what I told them.
Just on that, as far as the party politics, I had the fortune of coming into this file a bit later. I was going over the Senate testimony, and my gosh, the stories that were told. I encourage you to just how bad this situation is, and it needs to be addressed. And I think the urgency that these people, the stakeholders that are in front of us today, are very understating what's going on out there. It is truly horrific, and I can't imagine being in a workplace like this and still willing to serve. They have to go into that burning building. They have to go in and serve that patient. That's their job, and they do it day in, day out. Surely we can give them some recognition and give them some protection from Parliament.
To your question, my offer in my last conversation was, I don't care who stands and asks for UC on this. I don't. I just want to see it done. And the message we got back was quite disappointing from the House Leader on the other side. Great. Thank
This
you.
will complete our press conference. This will conclude the press conference. Thank you very much.
Great.